Hello, everyone. My name is Kirsten Charles, and today I will give you an overview of the major components of the United States healthcare delivery system. Our goal today is to understand the definition and importance of the healthcare delivery system and its key components. By the end of this presentation, you will have a clearer understanding of its providers, the settings in which they occur, and who the purchasers are. Let us start by defining the U.S. healthcare delivery system and its importance. The healthcare delivery system in the United States comprises a network of organizations, professionals, and settings involved in providing health services. It includes healthcare providers such as hospitals and physicians, various care settings like outpatient clinics and long term care facilities, and payers such as Medicare, Medicaid, and private insurers. The system is also shaped by regulatory bodies and policies that govern care and delivery. Integrated care models aim to coordinate services across different providers and settings to improve outcomes. Understanding the healthcare system is important for identifying how services are accessed and financed, and for developing strategies to enhance quality of care and efficiency. The U.S. healthcare delivery system has various types of providers, including physicians, non physicians, providers, and nurses. The Affordable Care Act, or ACA, has increased coverage for its citizens, resulting in a higher demand for health service providers, according to Cheyenne Singh. Physicians are critical as healthcare providers and can specialize in different fields. They evaluate health conditions, diagnose, and recommend treatments. Cheyenne Singh emphasized that while many physicians practice in hospitals or public sectors like school and community health care centers, most are office based. The rising cost of medical services contribute to healthcare inequity. Physicians must determine whether the higher cost of treatment is justified. To address physician shortages, the ACA's Advanced Nursing Education Program has allocated $30 million to train nurse practitioners and certified midwives, as noted by Cheyenne Singh. Non-physician providers, such as nurse practitioners, physician assistants, and certified nurse midwives, are becoming increasingly important. Cheyenne Singh highlight that these providers can offer substantial primary care services, which helps mitigate the impact of physician shortages and expands access to care. This helps to address the inequity of decreased medical access in the U.S. healthcare system by decreasing access to care as the physician workforce shrinks and the senior population expands. Nurses, the largest group of healthcare professionals, provide essential care for patients' physical, mental, and emotional needs. There are two types of nurses: a registered nurse and a licensed practical nurse, according to Cheyenne Singh. Jurashek discusses a projected deficit of 918,232 registered nurses by 2030. This shortage could exacerbate inequities in healthcare access. To address this, Cheyenne Singh suggests that healthcare organizations offer incentives to make the nursing profession more attractive. The U.S. healthcare delivery system includes both outpatient and inpatient settings. Outpatient care, also known as ambulatory care, allows patients to leave the hospital on the same day, while inpatient care requires at least a 2-night stay as described by Whitlock. Outpatient settings, such as public health services and community health centers, are crucial in addressing healthcare access inequities. According to Cheyenne Singh, public health services serve inner city, poor, and uninsured populations, while community health centers provide care in medically underserved regions, ensuring services are available regardless of the patient's ability to pay. According to Cheyenne Singh, long-term care, such as nursing facilities, is an example of an inpatient setting. These facilities focused on post-acute continuity of care, chronic illnesses, management, comorbidities, and restoration of physical function. Konteska explains that the shift in funding from institutional long-term care to home and community-based services has led to higher hospitalization rates due to a lack of professional medical knowledge among caretakers. This shift has created inequities in access to long-term care. One of the main characteristics of medical care delivery in the U.S. is the complexity of financing, according to Cheyenne Singh. The purchasers of medical care include insurance, government, and individuals. Cheyenne Singh define insurance as a mechanism for protection against risk. They further explain that insurance often involves shared costs between employers and employees in the private sector, with the employer covering most of the cost. Cheyenne Singh explained that managed care plans such as HMOs and PPOs are examples of this type of insurance, and that most health insurance is provided through managed care plans. Access to health care can be influenced by an individual's ability to pay copays and deductibles before utilizing care. Affordability is a dimension of access to health care, which can influence whether insurance is equitable, according to Cheyenne Singh. Government funding has been essential in expanding access to healthcare services since 1965, particularly for individuals who might not have otherwise been able to afford them. Today, a substantial portion of healthcare services in the U.S. are funded through public programs. Sandhu discusses how Medicaid is funded through federal and state partnerships, in which the federal government sets eligibility requirements and the states administer the program. Medicaid promotes equity in healthcare access. It has done this by using the Affordable Care Act to expand the program to cover over 12 million additional Americans. In addition, because Medicaid recipients face socioeconomic challenges, the program has been motivated to integrate social care into healthcare delivery. Medicare also plays a significant role, particularly with reforms introduced through the ACA to create accountable care organizations and the Center for Medicare and Medicaid Innovation, as highlighted by Chernew. Medicare is available to 3 groups of people. 1, individuals 65 or older. 2, disabled individuals who are eligible for Social Security. And 3, those with end-stage renal disease who require a transplant or dialysis regardless of their income status, according to Cheyenne Singh. These reforms aim to address healthcare system inequities and increase access to healthcare. On to individuals. Self-employed individuals purchase health insurance directly from the open market. Individual private health insurance, non-group plans, represents a modest but significant source of coverage for certain Americans. This type of insurance is commonly used by family farmers, early retirees, self-employed individuals, and employees working for businesses that do not provide insurance. Previously, high-risk individuals could not obtain this type of health insurance. However, the ACA eliminated the barrier, according to Cheyenne Singh. Individual private health insurance can create equities through high cost and variable coverage, but also addresses inequities by offering more options and protections for those without employer-sponsored insurance. In conclusion, I hope you have enjoyed the presentation, in addition to having a better understanding of the basic components, how they interact, and how those relationships create or deny equity and access to the healthcare delivery system.